Did you ever do sports in high school? Well, if you have, you've probably seen athletes get hurt and have to be brought off onto the sidelines. This really encouraged me to want to become a physical therapist and to study kinesiology. Because physical therapy is such a one-on-one job, you need good communication skills to perform well in your career. I often go onto Google to look up my injuries, and it really leads me down a rabbit hole. But I never seem to get tired of looking up why my muscles are acting a certain way or how my joints work with my muscles. Communication such as listening, knowing your patient, and speaking your patient's language are very crucial when you want to be a physical therapist. There are many forms of communication, but these are the ones that I think are key. One form of communication that I think is really important is listening. Patients feel understood when their physical therapist is listening. I know that when I went to physical therapy, my physical therapist was really good at listening, and it made me feel very understood and very confident in getting a correct diagnosis from them. This also helps the physical therapist by getting the correct information to create the correct diagnosis. The patient also needs to be able to tell their story without being interrupted. According to foxrehab.org, a study from the National Institutes of Health showed that patients are interrupted just 12 to 23 seconds into their examinations. Good listening skills can form a good bond between the physical therapist and the patient, which leads me on to my next point. Knowing your patient. Knowing your patient is important because by getting to know your patient, you're able to speak in their language. For example, if they are more laid back, you can use more laid back language towards them. If they are more very proper and very strict, then you can use more of that language towards them. A patient also wants to feel comfortable with their physical therapist. By getting to know your patient more than just what is going on with their body, this can help them feel more comfortable and tell you the correct symptoms that they're having in order for you to create a correct diagnosis for them. Getting to know your patient is crucial when relaying information to them as well. According to foxrehab.org, taking notes of your patient's verbal and nonverbal responses in your interaction and catering your communication towards their treatment to how they respond is very effective. I think that a lot of physical therapists use this in their day-to-day work. Knowing your patient also means knowing the language that they speak. Being able to talk in your patient's language is very important because if the patient speaks a different language, the physical therapist needs to try their hardest to be able to refer them to a different physical therapy or to be able to form some type of translation between them. Being familiar with how they speak and how they comprehend information is also very important. According to edumed.org, using things like graphics or illustration has been very effective for visual learners because they can understand pictures better than they can understand words. Speaking your patient's language is crucial for your patient to feel comfortable telling you how they feel. I think that a patient and a physical therapist bond is very, very important because being able for the patient to feel comfortable in their surroundings can help them express more as to what they're feeling. Communication is crucial when it comes to being a physical therapist. Communication skills such as listening, knowing your patient, and speaking in their language are the three key points that I think are important. Feeling comfortable is something that we all want when it comes to getting a diagnosis, whether it be at a physical therapy appointment or any sort of doctor appointment. So if you ever need to go to physical therapy, make sure that they have good communication skills.